Hi, this is Cheryl Schwartz, and this is another episode of Healthy Tips for Tails. And today we're going to look at a video together, a video of one of my patients walking. His name is Max, and I'm going to give you a little bit of a history. Max is a little bit over 2 years old. He is a golden retriever, belongs to a really nice couple who love him very much. And Max started to not be able to open his mouth really wide, and this was several months ago. And he started losing the ability to open the mouth and to hold things. We met online a couple of times until we finally saw that what was happening was an issue with the muscles in his head. And this is an immune-mediated issue, a long word, eosinophilic myositis complex, but it's an immune-mediated issue that destroys the muscles of the face, the forehead, and the head, so that you're not able to use the organs on your face. At first, we used homeopathy. We also used an herbal complex. As things progressed a little bit, I had my clients go to a local veterinarian for an integrative approach where we added steroids to the regimen. Max started to do really well. And after a little bit on the steroids, was doing so well that they started looking at the possibility of using stem cells. Now, stem cells, as you know from human medicine, is used as a regenerative process. And it's been used in veterinary medicine for a little bit now. And the veterinarian with whom my clients were dealing was able to do a harvest of stem cells. And even though stem cells have not been used for this particular muscle issue, since it was immune mediated, everybody felt it was a good idea to try it. And the way stem cells are harvested is the animal is put under anesthetic, and there's an incision made on the midline from the chest toward the abdomen. The skin is pulled away a little bit, and they take out the fat cells and the subcutaneous, the tissue beneath the skin, close the skin back up, and then do a process of re-injecting the stem cells. My patient Max did really well for about 2.5 weeks or so. And after that, my client called me and she said, Cheryl, I want you to take a look. I don't know what's going on, but we're walking with Max. He's doing better. And as he's walking outside, he keeps stopping. And he doesn't necessarily want to go further, and we don't know why. He's better on a soft surface than on a hard surface. So I asked her to send me a video. And this is the video we will be looking at together. And what I'd like you to do is I'd like you to watch the video with me and start thinking about what you see. So what we're going to do now is share the screen, and we're going to put this on, and there we go. So I want you to look at Max walking. So tell me what you see. Does the walk look normal to you? Is there anything that looks a little bit out of place to you? Is the position of his body as he is walking, is that normal? For my client, there was something off and she didn't quite know what it was. So what I'd like to do is show you the video again. The video is less than a minute long, and have you use what we call in Qigong soft eyes. Soft eyes are basically to lower your lids just a little bit and widen your peripheral vision so that you're not directly focusing on one thing, but you're just enabling everything in the vicinity to come into your being and to come into your line of vision. It's spreading out your vision so that you can see more or see differently. So I'm going to play it one more time. Okay. And I wanted you to notice, did you notice how toward the end of that walk, he kind of stopped and didn't want to move on? What I'd like to do is I'd like to walk you through what I saw on this video and also talk to you about how wonderful my client was in diagnosing what was going on. So here we go for the third time. So these dogs have a wiggle walk anyway, but this walk to me was a hyper wiggle. There's much more rotation in the lower part of the body, and the legs, the hind legs, are being thrown out on both sides. So they're like circling on both sides. His head is a little bit down, and he's landing more on one side than the other. And with that, he's landing to me heavier on the right front. And you see him circumventing his hind legs. So as I'm watching this, what I see is I see a disconnect between the upper part of the body and the lower part of the body. That the middle part of the body does not seem to have the strength to support. So there's not a connection with the free flow of the shoulders, then the abdominal muscles, then the hips. And with that, in order to keep things going, he's got to lower his head each time. And one side is hitching more than the other. So I talked to my clients about how possibly this was a remnant from the original injury with the muscles on the skull and how it goes down to the front legs, and there was an issue. And my client, who's very wise, said to me, Cheryl, do you think it has anything to do with the procedure that we did almost 3 weeks ago? And I went, oh my God, of course. When you do an incision, there's then a healing process that goes on. And if you're walking bent over, the tissue is now coming down to the skin where the incision line is. And one side is healing a little bit faster than the other. So you get a scarring going on, a fascial pull. The tissue under the skin is pulling a little bit more tautly on one side than the other. And that there is an actual tissue disconnect that's starting to come together again. So we talked about the possibility of using a supplement that enhances the ligaments, so that the ligaments can strengthen the tissue. And Standard Process has such a supplement called Ligaplex, but I'm sure there are many around. And we also talked about using some massage or qigong. And basically what I would do, and I'm going to stop sharing so you can see me for a second, is I would take my hands, rub them together, and create an energy field. And then I would run my hands down the sides of his body. So going from over the shoulder, down through the waist, down to the hips, and just a few times. You could actually touch, or you can be a little bit away from the body, just connecting the energy around the body. And in this way, you're helping to connect. The other thing I would do is I would do a little bit of a massage right behind the rib cage and what we call the kidney points on the back. They're between the first and second lumbar area in the muscle chains on both sides of the back. And lastly, what I would do is I would take a breath and say, okay, this is part of the healing process. I got a call from my client a week later when I asked her if I would be able to use this video. And I asked her how Max was doing, and she said, really well. So sometimes it just takes tincture of time. And one of the reasons I wanted to show this video was to give you the opportunity of getting a sense of when you see your animal or someone else's animal walking different ways. How do you approach that? Do you see something that is abnormal? Is it normal to you? And then do you trust what you see? So this is a function of using your common sense your eyes in the soft vision, in the expanding of the vision, in focus and in stopping for a moment to experience. Oftentimes, our animals will have issues with gait and issues with lamenesses. And before running to get x-rays or getting it checked out, which of course, a lot of times we really need to do, take a moment to see what is going on. Can you figure it out? Okay, that's it for today. Thanks so much. See you next time. And I'm going to stop the recording. Thank you.